The reproductive system's top 10 vocabulary terms. First, the male reproductive vocabulary. These consist of testes, sperm, vas deferens, the prostate gland, and the penis. Female reproductive vocabulary consists of ovaries, fallopian tubes, the uterus, cervix, and vagina.
In this section, I will talk about the diagnostic procedures for the female reproductive system. Colposcopy. Colposcopy is the examination of the vagina and cervix using an optical magnifying instrument called a colposcope. A colposcopy is performed when a provider finds problems or abnormal cells during a pelvic exam or Pap test. During a colposcopy, a provider will look for abnormalities in the cervical and vaginal tissues. Hysterosalpingography. Hysterosalpingography is the radiography of the uterus and fallopian tubes with the use of a contrast medium. With this X-ray examination, a provider can identify any tubal obstructions. Laparoscopy. Laparoscopy means to visually examine the abdominal cavity with a laparoscope, which is a thin lighted tube that contains a camera. The laparoscope is inserted through one or more small incisions in the abdominal wall. Carbon dioxide is used to inflate the belly, making the area easier to see. This procedure is minimally invasive and typically done under general anesthesia. Some conditions laparoscopy can be done to check for include tumors and other growths, bleeding inside the belly, infections, and blockages. In women, it can check ovarian cysts, fibroids, pelvic pain, and the fallopian tubes. Mammography exam, called a mammogram, uses a low-dose X-ray system to see inside the breast. The X-ray is a non-invasive medical test. Mammography. Mammography is X-ray imaging of the breast to detect tumors and other abnormalities. Diagnostic mammography is used to investigate suspicious breast changes, such as breast pain, a new breast lump, unusual skin appearance, or nipple discharge or retraction. The examination process can take approximately 20 to 30 minutes. Mammography does not prove an abnormal area is cancer, but if the area raises concern, a provider can perform a biopsy to receive further results. Papa-Nicolau test, or Pap test for short, is a microscopic analysis of a small tissue sample obtained from the cervix and vagina using a swab to detect cervical cancer or other problems. Gynecologists recommend women at least the age of 21 to start cervical cancer screening, even if the individual is not sexually active, and should have annual checkups. A Pap test can diagnose infection, inflammation, abnormal cells, precancer cells, and cancer. Digital rectal examination. Digital rectal examination is the examination of the prostate gland by finger palpation through the anal canal and the rectum. A provider feels the back wall of the prostate gland with a lubricated gloved finger and checks for enlargement, tenderness, lumps, or hard spots. The examination may be conducted annually for men over the age of 50, men in high-risk groups, or those who have a strong family history of prostate cancer. Prostate-specific antigen test. Prostate-specific antigen test is a blood test used to screen for prostate cancer. The test measures the amount of prostate-specific antigen in the blood. Prostate-specific antigen is a protein produced by both cancerous and non-cancerous tissue in the prostate. Elevated levels of prostate-specific antigen are associated with prostate enlargement and cancer. A medical technician will most likely draw blood from a vein in your arm. The blood sample is then analyzed in a lab to measure your prostate-specific antigen level. Transrectal ultrasound and biopsy of the prostate. In transrectal ultrasound, an ultrasound probe is inserted into the rectum. The ultrasound uses sound wave echoes to create an image of the prostate gland to visually inspect for abnormal conditions. The ultrasound may be used for guidance when performing a prostate biopsy. The prostate biopsy involves inserting thin hollow needles into the prostate to get samples of prostate gland tissue where the abnormalities are detected.
The following are medical and surgical procedures that are associated with the reproductive system. The first is circumcision. This is the surgical removal of the foreskin or prepuce of the penis, usually performed on a male infant. The next is a vasectomy. This procedure is done by cutting of the vas deferens from each testicle, removal of a small segment, and then tied off. This procedure makes it so the sperm that is created in the testes cannot reach the female reproductive system. Transurethral resection of the prostate is a surgical procedure to relieve an obstruction caused by a benign prostatic hyperplasia. This is done by an insertion of a rescoscope into the penis and through the urethra to chip away at any prostatic tissue that may be causing problems. The following are the female reproductive medical and surgical procedures. The first is the cerclage. In this procedure, a suture is used to hold the cervix closed to prevent any spontaneous abortion. This procedure is often used when there's an incompetent cervix. The following procedure is dilation and curettage. This is a surgical procedure that widens the cervical canal of the uterus so the endometrium can be scraped away. The following has a name called a hysterectomy. This is a surgical removal of the uterus, a fallopian tube, and or an ovary. The next is a lumpectomy. Excision of a small primary breast tumor and some of the normal tissue that surrounds it. This is generally the first step in finding a breast tumor. Mastectomy is a complete or partial excision of one or both breasts. Reconstructive breast surgery is the reconstruction of a breast that has been removed due to cancer or other disease. This surgery often has to take tissues and pieces from other parts of the body in order to reconstruct the breast that is now missing. Last is the tubal ligation. This is a sterilization process that involves blocking both fallopian tubes by cutting or burning them and tying them off. A similar procedure to this for the males would be vasectomy. The following are abbreviations for the female reproductive system. Now, here are the abbreviations for the male reproductive system, as well as sexually transmitted diseases.